I'm here to speak to you today regarding BloodSTOP. This is a product which I'm currently using in my practice, which I started using approximately 3 to 4 years ago, and it significantly changed the way I do things. I have been using hemostatic agents for the last 20 years in surgery, and BloodSTOP has qualities which make it much better than the other agents I've used. It includes being able to be left in place on a surface wound, irrigated off, providing a moist environment for wounds to heal in, which in plastic surgery, as we know, creates the best environment for wound healing, a moist environment. And actually, with this, allows wounds to heal faster and more appropriately. It's more physiological. For example, in a large case that I had, a patient had a congenital malformation where the skull continued to bleed. This patient required multiple units of blood every time we did the procedure, which was life-endangering, also increased the risk of HIV and hepatitis C, and I was using other blood hemostatic agents to improve the quality of the operations with no success. Then I encountered BloodSTOP, for which I was using in a sandwich-type form, which decreased the amount of bleeding and provided a moist surface to help propagate epithelialization and closure of the wound. We go from a case with such an extreme to everyday cases where I might be doing a rhinoplasty, a nose job. Recently I did one and packed the patient like I normally would. After packing the patient as such, there was some bleeding after, which normally wouldn't be an issue, but this patient was very anxious and continued to bleed. And then I thought of BloodSTOP. I removed the packing. I placed the packing back in, but wrapped with BloodSTOP. And in 2 or 3 hours, all bleeding stopped. And in 2 or 3 days, I removed the BloodSTOP very easily. Much more easily than had I not placed the BloodSTOP. And what made it even better, it was more comfortable for the patient. The BloodSTOP formed that gel layer. The packing pulled out atraumatically and allowed me to tell the patient to do irrigation of the nose to remove any additional product. But of course, it would be like mucus, so it made it very easy for the patient. For this reason, BloodSTOP is an excellent product. I'm looking forward to the United States approval of BloodSTOP internally and being left into place. This would be a true game changer. Though right now, as I use it on the surface, packing in the nose, and for many other uses, it actually has revolutionized the way I treat patients with improving an outcome and improving patient care. I would suggest many surgeons use BloodSTOP instead of other hemostatic agents on any type of surface wound and any type of wound where this can be irrigated out and not considered an internal cavity